So I've seen this term used a couple times, and I want to point out right away that the term post-racial America is a total junk term, but it's something that we started seeing a lot of in 2008 because, electing President Obama, then there was this kind of idea that there was less racism that people were going to face. Well, we all know that that's false. In the last couple of years, we've seen lots of examples of that, but when you actually look at the FBI statistics, from 2016 to 2017, those numbers did go up. So they received 7,175 criminal incidents related to some type of bias or hate crime and 8,437 related offenses. And as you can see in the little infographic, by far the vast majority of these incidents were based on race, ethnicity. So hate crimes are continuing to go up despite the fact that we supposedly live in a post-racial type of America. And what's been interesting too is to see with the internet how newer forms of hate crimes have actually emerged. And I've just heard within the last year there's been a lot of pushback to YouTube about allowing certain groups to have very hateful types of videos and messages that are on there, and this kind of back and forth about what is freedom of speech and who can say what, and the use of social media platforms as a way to spread hate and then trying to claim, the First Amendment under that. So it's really a problem that has far from gone away, and that's something that we need to be aware of. So individuals of color in America, we know this is something that they face every single day on a continual basis, from, things that are very distinct acts of racism to microaggressions. And microaggressions are those things that convey ambivalence and promote defensive thinking. It's the commonplace little things that are verbal, behavioral, kind of institutional, that aren't necessarily intentional or intended to cause any harm, but that absolutely do demean and insult others and cause significant harm over time. And things like that do include denial of racism, racial ambivalence, and colorblindness. So there is research that shows that people who face microaggressions experience immediate distress, and that the long-term accumulation of such distress actually leads to a impairment in their overall well-being over time. So racism in and of itself is a social determinant of health. So it's not, and when we talk about social determinants of health, I think it's important to be careful about our language. People always say that race is a social determinant of health. Race is not a social determinant of health. Race is just race. Racism is the social determinant of health because it is the stress caused by reduced access to employment, housing, and education through institutional racism. It's the increased exposure to risk factors. It's all of being put, racism causes adverse cognitive emotional processes. There ends up being diminished participation in healthy behaviors and increased engagement in unhealthy behaviors, because some of the most extreme reactions to facing constant racism is developing maladaptive coping strategies. So things like substance use disorder, suicide, self-injurious behavior, risky sexual behaviors, violence, aggression. There are higher rates of raised blood pressure, increased psychological distress, depression, negative self-esteem, intrusive thoughts, and overall decreased quality of life. And beyond just racism, there's actually a movement to identify and define race-based trauma. So race-based trauma is the emotional, psychological, and physical reactions to personal experiences with harassment and discrimination. So this can be characterized by an emotional injury that's motivated by hate or fear, a racially motivated stressor, and I would say that, well, I'll pause that, a racially motivated stressor that overwhelms a person's capacity to cope, an interpersonal severe stressor that causes bodily harm or threatens one's life or one's personal bodily integrity, severe personal institutional stressor motivated by racism that causes fear, helplessness, and horror. And when people talk about the factors that contribute to race-based trauma, it's this kind of list of things. So obviously covert racism, yes, and it's the highest, when saying yes, all of these things factor into race-based trauma. Covert racism, that's kind of an obvious one. Hate crimes. Institutional racism is one that I think that goes right along with microaggressions, in that it doesn't get enough talk. Certainly not enough action for movement. overt acts of racism, racial discrimination, racial profiling, another really high one up there, and within racist group comments. We know that it leads to health disparities, so there is a direct and indirect healthcare disparity related to this unequal access to social, educational, material resources. Individuals of color, and this is very specific to America. I'm not going to generalize outside of America, although this happens in many countries. I'm trying to stick specifically to what we know about America so that we can actually do something here. Individuals of color are less likely to have health insurance and therefore experience unequal access to quality health care. There's higher rates of obesity, infant mortality, heart disease, stroke, cancer, diabetes, kidney disease, hypertension, liver cirrhosis, and homicide. They're also much more likely to experience racist attitudes and discrimination and microaggressions from their healthcare providers. So as a mental health counselor, and that's tends to be my slant on most things, we're going to talk specifically about mental health and race and culture. So there are specific mental health disparities. Black African Americans are 20% more likely to experience and report serious psychological distress, more likely to report feelings of sadness, hopelessness, and worthlessness. They're twice as likely to be diagnosed with schizophrenia when all of the behaviors are, and if you compare the behaviors of white and black, when everything else is equal, they're twice as likely to be diagnosed with schizophrenia. Interestingly, black teenagers are more likely to attempt suicide, but they're less likely to die of suicide. In South Asian Americans, the age, especially between ages of 15 to 24, they're more likely to exhibit depressive symptoms, and there's a higher rate of suicide among young South Asian American women than the general US population. So significant mental health disparities for people of color in America. And when you ask people if they're seeking any kind of help to address race-based trauma and the stress caused by racism, most of them will say that they did seek some kind of help. But most of them are seeking help from friends, some from family members, less from a spouse or colleague, but very few are seeking help from a medical professional. And researchers are hypothesizing that this is because of a lack of awareness among helping professionals on how to appropriately address racial issues. When they do get into treatment, there's also really disparate kinds of statistics to look at, because African Americans have a 73% lower odds of being diagnosed. And this is really where you get into the medicalized versus criminalized. So when you compare the two populations, compared to white Americans, African Americans are more likely to be labeled as a delinquent or criminal, where the exact behavior in white Americans is medicalized and given a diagnosis and then referred to treatment. Asian Americans have a 64% lower odd of medication use and a 51% lower odd of getting into therapy. South Asian Americans had the lowest rate of mental health utilization. Within psychiatry, it's been shown that minorities are more likely to achieve less likely to achieve symptom remission and more likely to be impaired with a chronic impairment. And part of this is due to the types of therapy that are recommended. So I did hear a statistic a couple years back about the recommendations for use of clozapine for schizophrenia. So Black Americans tend to be less likely to be prescribed clozapine, despite it being one of the most effective medications. And there's lots of reasons that people give why, but it really gets into that implicit bias. And that has been what's shown to be a major cause of this. So again, just looking at youth in particular, when you compare the behavior of Black youth and white youth, if everything else is the same, more of the white youth are referred to mental health services and given a mental health diagnosis, referred to treatment, where the Black youth are referred to juvenile justice and labeled as delinquents. And when looking at the predictive factors about which system youth would be shuffled into, demographic variables were the most predictive, with ethnicity specifically being the most indicative factor about whether or not the youth would be put into criminal justice or mental health systems. Even further, there's a lot of concern about what happens if they do get into treatment once that happens, because Black Americans are more than twice as likely to experience psychiatric hospitalization. So there's the fear of, okay, well, now I get help, but now I'm going to be locked up. And I'm either going to be locked up in the criminal justice system, or I'm going to be locked up in a hospital. So Black children, again, if you're looking at all of the same behaviors on paper, Black children are more likely to be diagnosed with schizophrenia, and Black and Latino children are more likely to be diagnosed with disruptive behavioral problems and conduct disorders. And when actually surveying, so there was one of the study that is referenced, and all of this, there's a lot of references that are on the end. They actually had all of the same information in two studies. The only thing that was changed, or like two case scenarios, the only thing that was changed was race, and the Black children were less often recommended for treatment because, and it's quoted, they're less able to benefit from psychotherapy because they're less articulate, competent, introspective, and sophisticated. So we'll come back to implicit bias, but there's no wonder that there's a good amount of stigma, because why? Yeah.
That sounded more like an explicit bias.
Yeah, that's pretty explicit bias, but we will get to implicit bias. So there's a lot of stigma. There's fear of embarrassment. There's fear that to admit mental health would be to dishonor the family. Belief that talking about or having mild depression or anxiety might be considered crazy in their social circles. Belief that discussions about mental illness aren't appropriate to talk about even with family. And the last quote there is actually from a great article that is also referenced, where it says, the culture of silence is so deeply rooted that some of us might not overcome it. If I tell everything, I will lose everything. If I tell anything, I will lose everything. There's also a major concern about the cultural competency of providers, and this is very justified. There's a concern that mental health practitioners are not culturally competent enough to treat specific issues related to race-based trauma, and individuals of color have reported experienced racism and microaggressions from their therapists and healthcare providers. None of this helps. And when you look at the amount of professional training people have received, so they did a study where they surveyed 106 counselors. Out of that 106, 33% said they had been trained to identify race-based trauma, but 67% had not. Only 18.9% had received training to treat race-based trauma. 81% had not. And what's interesting is that the people who had received training on how to identify and treat race-based trauma actually self-rated themselves as less competent to actually do so. So the people who had no training rated themselves as pretty competent to do this. And the people who actually had the training realized, and this is kind of that horizon of ignorance, like I don't know what I don't know, but now that I know that I don't know, I really know how much I don't know. And that's really this phenomenon that is going on here, is that I realize how much is going on, so I feel less able to do anything about it. So we have to get past nonsensical terms like post-racial America, and we have to stop using things like colorblindness, because to be colorblind is to say to persons of color, we don't see you. Colorblindness has really led us into race being a taboo topic. People can't talk about in polite society and can't talk about in their workplaces or amongst family members. But frankly, if you don't talk about it, you can't understand it. And if you can't understand it, you can't even begin to try to fix it. So we have to start talking about this in order to try to fix it. So how do we fix it? Hopefully through cultural humility and multiculturalism. So we're really just striving to talk, to understand, to learn. Cultural humility is this other-oriented stance where you're admitting the things that you do and don't know and asking to learn and learn with the person in front of you. So in becoming more multicultural, things that we can do is recognize and value differences and similarities. So finding the similarities, if you see somebody across from you that doesn't look like you, what do you have in common? Because I'll bet it's a lot more than you realize. But the differences that are there, recognize them and say, those are great. Teach and learn about differences. Normalize not knowing. Cultural humility requires an acceptance that not knowing is a precondition of growth. And if we're going to grow, then we have to accept that we don't know things. Continue to encourage introspection, self-reflection, and lifelong learning, and foster personal friendships and organizational alliances. So surrounding ourselves with people that are different from us is a very good way of starting to push towards positive change. So my takeaway points is that racism is a social determinant of health. Seeking help and addressing race-based trauma is going to be very difficult for many individuals for a lot of reasons. Implicit bias, culture, counselor and physician competency, stigma. There's lots of reasons that this is going to be really hard. Cultural humility is a step towards health equity, and it's okay to not know. Make sure that you're kind and be open. So this is my litany of resources that I think all of them have links, thank God. And that's all.